For the past few weeks, we've been working with numerous experts, pediatricians, Children's Hospital folks, child care professionals, parents, caregivers, infectious disease experts. These conversations have helped inform our plan, rooting it in the best science and practices that we could find. I will say that we do not have really any great data in regard to child care and COVID-19. While there is information, certainly best practices in regard to any spread of virus in child care. Studies have been done on that, but as far as COVID-19, there is not a whole lot of information out there. I'll talk about this in a moment, but we intend to rectify that. Our goal is very simple, and that is to do everything we can to protect the children in child care, the workers, and all the families. We want to have the safest child care system in the nation, one that nurtures the health and continued growth and the development of our young people, and one that protects the health and safety of our child care workers, teachers. Moving forward, child care is going to look different for children, parents, and teachers as long as this COVID-19 is around. But we must get this right, or we run the risk of exposing more individuals to COVID-19. And so, as I've said, we have based the reopening of child care and the protocols on the best science that we can find, and we've consulted with a number of experts in the field and with people who do this every single day, those who take care of the children. On May 31st, child care providers in Ohio will be able to reopen. They will reopen with reduced numbers of children in each classroom, intensified cleaning and hand washing practices, and many other changes. To explain in more detail how child care will look different, I've invited Joni Close, president of the Sisters of Charity of Canton, and who is the chair of our Early Childhood Advisory Council. And I want to thank her for her work and the rest of our folks that we drew from across the state of Ohio to really provide their expertise and their counsel to us as we make these very, very important decisions. Joni, thanks for joining us. We appreciate it.
Thank you. Thank you, Governor. I appreciate you and all the thoughtfulness that you put into this. There will be changes at child care centers for families and for children. Starting right when the children are dropped off, you'll likely see your child care provider with the mask on. The caretakers will maybe ask the parents to wear masks as well. Daily temperature taking will be routine, and anyone with a temperature of 100 degrees or more will be sent home. And as children enter their centers, they'll need to wash their hands, and they may be escorted to their classrooms by their someone other than their mom or dad, another adult. Classroom group sizes will be smaller, as you mentioned. For preschool and school-age children, there will be a maximum number of 9 children in a classroom. For infants and toddlers, there will be a maximum of 6 per classroom. And of course, summertime, we always look forward to field trips. Unfortunately, those won't be able to be held this year. There will be playground and outdoor activities, but again, a lot of sanitizing in between each group. So cleaning is the word of the day. Child care providers will be cleaning toys after each use, wiping down surfaces and any common areas. And centers, of course, will have to undergo rigorous cleaning at the end of each day. Children and teachers will wash their hands a lot. Everyone will need to wash their hands between activities, after meals, after play, and many more times. And so parents can help by getting their little ones used to doing that at home. And then it'll pick up again. Children will wash their hands before they leave. And again, the providers might ask that the parents wear a face mask for the pickup as well. And we know that these changes will be unusual and maybe a little uncomfortable for some families and children, but we're doing our best to be confident that these measures will keep everyone safe. And I'd be remiss if I didn't say that, the Sisters of Charity Foundation that I work for, we've been supporting early childhood for a long time, and research has shown the clear benefits of providing children with high quality early education and care. And now more than ever, I want to express my thanks and recognition to the childcare providers, the teachers, and the administrators for their care of our children and for their support of the families and for the important place that they hold in getting our economy back. I am grateful to Ohio for your investment in quality early childhood, future and past. And I'm confident that our child care providers are up to the task and that they'll do everything they can to protect and serve the children and the families that they serve. Thank you, Governor, so much.
Joni, thank you and the rest of your group for doing this. We're very, very grateful. Thank you very much.
You're welcome. Thank you so much.
We are taking a cautious approach. We want to continue to inform that approach with additional data. The reopening of childcare, just like so many other things that we're doing, we're really doing for the first time. There's really no playbook out there for this. There's no playbook for conducting childcare, such an essential thing, so very, very important. But there's no playbook for conducting it really during a pandemic such as we have today. So we will be continuing to monitor how things are going. We will learn as we go forward. We may make changes as we go forward. We are starting this off, we think, on the right foot. We think we have the right protocols, but there is additional information that I'm sure we're going to continue to see and continue to learn, and so there will be changes made as we move forward. We will be conducting a research project to study best practices for controlling the spread of COVID-19 in child care settings. This study will make Ohio, I think, a leader in reopening child care and how we conduct child care. As we gather more and more data from the study, it will continue to inform our decisions, and there will be things that we learn as we move forward.